There has been a rise in the use of GLP-1s for weight loss. Celebrities and influencers have come out documenting their experience as they share their weight loss journeys. But this new trend has also brought up some questions regarding the long-term effects and overall safety of GLP-1s. To help give us a better perspective on GLP-1s, we are bringing in Doctor Robert Catania, a surgeon at Southern New Hampshire Weight Management. He is an expert on weight loss, GLP-1s, surgeries, and strategies. Good morning, doctor, and thanks so much for joining us. Let's dive right in. What about GLP-1s and aiding weight loss? Its intentional use is to help people with diabetes. Is that correct?
Correct. It was first discovered in the 90s and then started used in the early 2000s for diabetes. It was found to have a benefit to weight management as well through those diabetes uses. And so in the mid 20 teens, we started using it for weight management as well.
And from what I understand, it's been very successful, but there are pros and cons that come to using this weight loss medication. Can you go into those, please?
Sure, absolutely. So all medications have pros and cons. When you use the right medication for the right patient, it can often be very successful. So the benefits are improved diabetes management, improved weight management. It actually helps with obstructive sleep apnea. It can help with lowering cardiovascular risk. So lots of good things about using the medication. Cons, it can have some GI side effects. And also if it's used by the wrong patients, or if the patients don't use the right diet and exercise program in conjunction with the medication, it can cause problems like muscle wasting, gastroparesis, things that you really want to try to avoid if you use the medication properly.
And there has been a lot of side effects coming out from influencers and other people who are on it. I've heard of GLP-1 breath, as well as it potentially causing protein deficiencies and hollow cheekbones. Are these also real side effects?
Yeah, they can occur. I would call them more the results of misuse of the medication. However, I think it's really important when you're on a medication like this that's so powerful that you're being carefully monitored by a healthcare team so that you're making sure you're getting enough protein, getting enough vitamins, and you understand why some of these changes are occurring so that you can counter them if they occur.
Earlier that some people are better suited than others for this medication. Who are the people who are really well suited to be on GLP-1s?
So the FDA says anyone with a body mass index greater than 27 who has medical related problems associated with obesity like high blood pressure or diabetes should be using the medications, or anyone with a body mass index over 30 can also use this for weight loss. It's not really designed and probably shouldn't be used for people who are trying to lose 5 or 10 pounds.
All right. Thank you so much for joining us this morning, Dr. Catania.
Thank you.